In some cases, there is just an extended depersonalization syndrome, the sense of the patient's estrangement from himself that is very persistent. It comes in crisis again and again, and usually there exists the dissociation and potential repression of identification with the aggressor that has been repressed and needs to be brought out in the open, or dissociation of imaginary scenarios that could compensate for the trauma and were imagined but didn't take place. The most serious syndrome of dissociation are identity disorders in which the patient feels he is somebody else and declares that he is somebody else. And while he is somebody else, may remember who is normally or not. So there are two forms of identity disorder. Those in which the patient has several identities and is aware of the fact that in his memory he has several identities, while at each point he's only one definite person. In contrast to other cases where the patient while he has a certain identity, he doesn't remember any alternative. Usually there is a momentary it's the Dr. Jekyll, Mr. Hyde syndrome. The patient is one of two contradictory persons, or at most two or three that don't know of each other's existence. So here, if there is a repressive barrier between the activation of various persons, these are usually neurotic structures, severe trauma affecting the personality, and personality disturbance at a neurotic level with predominance of repressive mechanisms, multiple identifications that have to be resolved by the analysis of the defenses against conscientization of the alternative personalities, and sometimes by chemical means, by pentothal interviews, in using medication or hypnosis to undo the repression, and then being able to analyze the different mutually conflictual identifications. A patient may have one personality where she is a nun, and an opposite one of which she doesn't know anything, in which is a prostitute, so exactly opposite to the religious figure that she's consciously. It's a kind of dissociation frequently related to sexual trauma.